Two people have had allergic reactions to the Pfizer COVID jab on day one of the UK's mass vaccination programme. The regulator has now recommended those with a history of significant allergic reactions to not take it. RTUK's Issa Ali has all the latest for us. So, Issa, not exactly the start the government wanted.
No, absolutely not. We do know, of course, that there is a sizable minority of people within the country who are perhaps hesitant to take this vaccine, and this latest news won't do anything to allay the fears of some that perhaps not all aspects have been investigated during the rush to try to get this vaccine out. Now, we understand from the MHRA, they are of course responsible for regulating medicines in this country, that two people have suffered from allergic reactions. They are recovering from what we understand, but that still hasn't stopped them from putting out warnings as to the types of people who should perhaps avoid taking this vaccine. They include people with allergies such as nut allergies, and people who have to take EpiPens, those adrenaline injectors which help people with epilepsy. So some warnings there, and the CEO of the MHRA is Dr. June Rain, and she says that it's important that all those who are responsible for administering the vaccine have this information to hand so that they can properly inform the public.
Even last evening, we were looking at 2 case reports of allergic reactions. We know from the very extensive clinical trials that this wasn't a feature, but if we need to strengthen our advice, now that we've had this experience in the vulnerable populations, the groups who've been selected as a priority, we get that advice to the field immediately.
Now, over in the United States, there have been other quite bad news, if you will, from the FDA. They're responsible for administering and regulating drugs over there and medicines over there. And they've said that 6 people who took part in the Pfizer trials have since died. Now, so we understand some of those who took part in those trials took the placebo and not the actual vaccine itself. So there's no evidence it's the vaccine which has caused those deaths. But in any case, will lead to concerns to some. The FDA, of course, haven't approved that vaccine like the United Kingdom have, and we've also heard from Dr. Anthony Fauci over the past week or so, who is, of course, the man coordinating the White House's response to COVID-19. He's expressed his surprise that the United Kingdom gave approval so quickly for the vaccine. Meanwhile, here in the UK, we've heard from the Chief Medical Officer, Chris Whitty, who said that possibly the vaccine isn't strong enough to give protection from COVID-19, and that further doses might have to be taken in order to give full protection.
We know that these are very good vaccines to provide short to medium term protection. We don't know how long that lasts. It might last for a very long time. It might last for 9 months. I think it's more likely to be somewhere between those two. And in that case, we may have to have a situation where we have to be in a position to revaccinate, particularly people who are the most vulnerable. So I think all of these we'll have to think about as the information comes out on length of effect, efficacy, safety, and so on, and which vaccines best suit which people.
Now, defenders of the vaccine programme will say that these are all to be expected. These are just normal teething problems that have to be ironed out with such a large-scale effort to try to vaccinate this many people. But others, especially those who have been hesitant thus far, will say that this is merely the consequence and the expected consequence of not doing enough tests and what they've felt has been a rushed process.
Issa, thank you very much indeed for that update. Well, I'm now joined by a public health expert, Professor Gurch Randhawa. Gurch, afternoon to you. Thanks for being with us.
Afternoon.
The first thing you're usually asked before getting a jab is, do you have any allergies?
Yeah, so we don't know enough detail about whether these recipients of the vaccine were asked about allergic reactions. But I think the key thing is to reassure the public that, thousands of people received the vaccine yesterday. And as far as we're aware, 2 people had some side effects and both people are now fully recovered. But I think what this does illustrate, and I think it's been a theme in our interviews during the sort of pandemic is that we do need regular communication from the government to the public. So daily briefings reassuring the public around the vaccine, around the potential side effects, would be far more reassuring rather than silence, because in the silence, that vacuum will get filled with potential scare stories.
Are you surprised, though, by this news? I mean, surely scientists would have considered allergies during the trial stages.
So you're absolutely right. With all medications or vaccines, there's always potential for side effects and allergic reactions. So again, thinking positively about this, we've got a really robust monitoring system in the UK. So these 2 individuals were picked up. The MHRA have now issued specific guidance. But I think the key point is as we're getting closer and closer to Christmas, we need to remember the vaccine is only one part of a 3-part solution to the pandemic. The first part is still public protection. So we need to ensure people are wearing masks, washing hands, social distancing. We also need to ensure that people are still getting tested if they have symptoms, doing the contact tracing, and most importantly, isolating if asked to do so. And the final part is the vaccine. And we must not forget that, because otherwise, if people do gather over Christmas, the chances are that infection rates could really spiral out of control.
All very valid points, good points. But coming back to the vaccine, there is a certain element of distrust amongst the public about this lack of confidence. And this doesn't really help, does it, when we do see people reacting? But of course, these patients are recovering. But how dangerous could a side effect actually, though, be?
Well, it's difficult to comment because we haven't got the data yet. I mean, once the MHRA had approved it, they'd obviously looked at the data based on thousands of trial participants. But the point about tackling trust, that can only be done if you actually have regular communication. So I would be an advocate for daily briefings, in the evening, so that the public can find out from the government and independent scientists what's going on in terms of the vaccine, what's going on in terms of infection rates, test and trace, so people can make informed decisions about how to plan for Christmas. And at the moment, we've just got silence when it comes to infection rates and we've offered the public a choice about Christmas, but we haven't really given them the real-time data. And the more information we give to the public, the better informed they will be.
And talking of Christmas, just finally then, what do you make of Wales, the situation there, where maybe they may backtrack? And obviously the restrictions loosening over Christmas here in England, many are questioning that. What do you think about Wales now? Perhaps it may backtrack.
I think every country in the world should be thinking very seriously about increasing contacts, because we know that this pandemic increases through more contact. So I would urge everyone to be, thinking very carefully how they plan to spend Christmas. If they are going to meet family and friends over Christmas, I would encourage people to do so outside. But
those with plans, though, Gert, should they now consider changing them?
Well, you could still meet, but I think you could, we're used to the British weather. So I would suggest we all layer up and wear several layers and meet outside and meet with your family and friends.
Gert, thank you very much indeed, Professor Gert Randhawa. Thanks for being with us.
Thank you.